Hello, Roxanne. Good to see
Dr.
you.
Dedo. Thanks.
Now listen, before we sit down and talk about what you need,
Yes.
we need to go over some things so you feel comfortable. One of the hallmarks of my practice is patients come in and I tell them the truth. This is what's can be done, this is what can't be done. There's no fluff, there's reality.
What do you find people looking for right now?
Right now, liposuction is hot. And that's kind of a play on words because it's almost like getting a mini tummy tuck without surgery, without a long incision. Patients are looking for no downtime. Doctor, I want to come in, I want this, I want a predictable result, I want no downtime. So you do a little Botox, a little fillers, they become comfortable with you, and then there comes a point in life when fillers and Botox aren't going to lift the face, aren't going to correct the saggy neck, aren't going to correct the jowls. Then they need a facelift. There comes a time in life when fillers and Botox aren't going to take care of fat deposits that collect, that regardless of how much you exercise, you're not going to get rid of it. And the neat thing about this laser liposuction is that we can address small deposits of fat, we can address large deposits of fat, and be able to sculpt the body and improve the result.
I like the idea that you can actually do this without anesthesia. It's more of a local.
The area we're going to treat with liposuction, we anesthetize with a tiny cannula, and the local anesthetic, it doesn't hurt. Patients will sit there and they'll lie there, correctly, and they'll talk to you. They'll listen to music and they'll share stories, and at the end of the procedure, they get up and they invariably say, you know, all the anxiety, all the stress I had worrying about coming into the procedure was nothing. This was absolutely nothing. But I'm going to caution you, it is not a procedure where you come in at 12 o'clock and you have a little liposuction of your stomach and you go back to work. That is a complete falsehood. If you have surgery, if you have some fat sucked out, you're going to go home with a compression dressing and you'll be out for a day or two. The neat thing is that it is not painful, that the patient can resume their normal activities. As a matter of fact, after liposuction, I want my patients to walk a mile that day.
You're kidding.
No, I want them to walk a mile because it helps the fluid drain out.
I like that there's no downtime with this.
There isn't. There is minimal downtime. The other interesting facet is that I believe that with liposuction, as you alluded to under local anesthesia, we can now address obese patients who might be candidates for gastric bypass and reduce their bodies safely without the threat of a general anesthetic and achieve the same results, but different from the gastric bypass that leaves you literally with curtains of skin hanging. The skin contracts up. We heat the skin up and it tightens it and shrink wraps it. One patient's lost almost 70 pounds, gone from a size 22 to a size 10, I believe. And she's happy because she has to buy a whole new wardrobe. But more importantly, her health has improved. She no longer has joint pain in her knees from walking. She no longer gets short of breath when she goes to the store and shops. She feels better about herself. And patients with a myriad of illnesses from obesity can now find a cure without having to have gastric bypass surgery.
When is there really an age for this?
If you take a woman in her 60s and 70s with a huge turkey water deformity and you redefine their neck, that is a dramatic change. It's a very difficult surgery, but it's a dramatic change. If that same person had that surgery at 40, they wouldn't really need anything for 15 or 20 years.
I think it's really important, before you even get to that, is to really feel comfortable with the doctor that you're working with.
You're absolutely right. That probably is the most important thing. Check their credentials. Ask to see their pre and post-op pictures. And if you feel comfortable, go for it.